Bisanga. Today I'll be talking about the follicular unit extraction in a higher Norwood scale. What is follicular unit extraction? The follicular unit extraction, it's one of the techniques used in hair transplant to harvest hair using a circular punch. Why a video on a high Norwood scale? It's easy to do a hair transplant on someone with limited loss, but those who have high Norwood scale, that's a classification for hair loss, one of the classification for hair loss, those with a high degree of baldness pose challenges because there is not enough hair in the back of the head that we call donor to cover everything that people will lose on top of the head. So this video will outline a little bit what you should know when you want to address your hair loss need. How do you choose your clinic? How do you choose your doctor? Because you can choose a clinic, but some of the clinics do not have a doctor operating on the premises, or the doctor is just there to give the legality, but actually do not perform surgery by himself. This is a surgery, so it's still a procedure that needs to be performed by doctors. So this video will outline what the reality of advanced baldness, how do you preserve the donor, because there's a limited blood supply that go to each individual follicular unit. So when you take too much, you disrupt that blood supply, and the healing process, the scarring that will take place afterward will have an impact on the quality of your residual hair. So it's important to make sure that when you go to a place, they just don't overharvest, they just don't take too much of your donor hair and leave you with a lot of problem to deal with. Unfortunately, we start seeing a lot of these patients who've been to some of those clinics that advertise 5,000-6,000 grafts in one day, in 3 hours, and the donor are being wrecked, and there's nothing you can do to repair them safely. I do a lot of repair. 30% of my work are repair work, and I'm facing with really challenges. So this PowerPoint presentation is just to go over the basic, to give you information, to give you education. Remember, you can always, in this time where we are on lockdown, you can always reach us. If you go to bhrclinic.com, you can fill up the consultation form, or you can go on the chat, and all the chats are coming to me, and we can set up an online video consultation free of charge, of course, and we can go in depth on all these things. thank you again, and keep watching. We'll continue on our channel to provide information and education on what you should know. Thank you. Bye.